Hi, everyone. I am Attorney General Kris Mayes, and I am so happy to be joined by my colleague, California Attorney General Rob Bonta. And we are here today because the health and safety of children across the country is not a political issue. It is not a culture war talking point. That's why today, Arizona and California are leading a multi-state lawsuit against the Trump administration, HHS Secretary Robert F. Kennedy Jr., and the CDC over their needless, confusing, scientifically unsound, and unlawful revision of America's immunization schedule. Let me be clear about what happened here. In January, an acting CDC director with no medical or scientific background signed off on a so-called decision memo that stripped 7 critical vaccines of their recommended routine vaccination status in favor of an unwarranted shared clinical decision-making recommendation that is confusing for parents and providers alike and difficult for providers to implement. The vaccines that got unlawfully demoted are protect children from rotavirus, meningococcal disease, hepatitis A, hepatitis B, influenza, COVID-19, and RSV. And it was done astonishingly without notice or public comment. This wasn't based on any new science. It wasn't based on expert consensus. It was based on an ideological agenda, one that Secretary Kennedy has been pushing for years, if not more than that. And to clear the way for that agenda, Kennedy fired all 17 members of the Advisory Committee on Immunization Practices, otherwise known as ACIP, the expert panel that has guided vaccine policy in this country for decades. He replaced them with individuals who, in many cases, simply don't have the qualifications that the law requires. This is not how science is supposed to work. This is not how government is supposed to work, and all of it was contrary to law. The facts on the effectiveness of vaccines in protecting America's children are not in dispute. Among children born in this country between 1994 and 2023, routine childhood vaccinations prevented an estimated 508 million cases of illness, 32 million hospitalizations, and more than 1.1 million deaths. They generated $2.7 trillion in savings for our society. These vaccines work. They are safe, and the science behind them is overwhelming. What Secretary Kennedy has done and what the Trump administration has enabled throws science out the window, replaces qualified experts with unqualified ideologues, and then uses the resulting confusion to undermine public confidence in vaccines that have saved millions of lives. The consequences of this won't be abstract. Lower vaccination rates mean more outbreaks. You are seeing this with the recent outbreaks of measles across the country, including right here in Arizona and Mojave County. More outbreaks mean more children in hospitals. More children in hospitals means greater strain on our state's Medicaid systems, on our public health infrastructure, and our schools and our communities. The administration points to countries like Denmark to justify these changes. But here's what they leave out. Denmark has a universal healthcare system. That means that all mothers are cared for during pregnancy, and every child there has a doctor that they can see after birth. In Arizona, and in rural communities across the state, across this country, millions of families don't have that. More than 100 million Americans lack regular access to primary care. Telling parents to just talk to their doctor sounds reasonable, but millions of families without a doctor, for those millions of families who don't have a doctor, it is essentially meaningless. Copying Denmark's vaccine schedule without copying Denmark's healthcare system doesn't give families more options. It just leaves kids unprotected from serious diseases, such as meningococcal disease, that has an over 10% fatality rate. That's why we are asking the court to declare this new vaccine schedule unlawful, to vacate the illegal ACIP appointments, and to stop this administration from gambling with children's lives to satisfy an anti-vaccine ideology. Arizona's children deserve better. Children across this country deserve better. That is what this lawsuit is all about. We want to ensure that families continue to be fully aware that vaccines continue to be safe and effective for their children, and we encourage them to vaccinate their children against diseases that are entirely preventable. And it's now my joy and pleasure to introduce my friend and colleague, A.G. Bonta.
Thank you, and good morning, everyone. Thank you, Attorney General Mayes. I'm proud to join my colleague as a co-lead of this lawsuit, marking California's 59th lawsuit against this administration. HHS Secretary RFK Jr. and his CDC are flouting decades of scientific research, ignoring credible medical experts, and threatening to strain state resources and make America's children sicker. Their actions have been unconscionable, illogical, and illegal. From blowing past appointment requirements for the Advisory Committee on Immunization Practices, ACIP, including that it be fairly balanced, and instead appointing several anti-vaccine advocates and people without clear credentials in immunization science, to allowing the unqualified and unlawfully appointed members of the panel to reverse nearly 30 years of CDC policy recommending that hepatitis B be universally administered at birth, to removing 7 vaccines from the list of universally recommended childhood vaccines, despite the overwhelming evidence supporting the effectiveness of the previous childhood vaccine schedule, and doing so without any new scientific evidence, any recommendation by a lawfully constituted advisory committee, or any systematic review of the available data. RFK Jr. and his CDC are violating the law, making a mockery of what should be trusted as the nation's leading voice on vaccinations, and endangering our children. As California Attorney General, I refuse to allow RFK Jr. to threaten the health and well-being of the more than 8 million young people who call the Golden State home, the 400,000 babies that are born here in California each year. RFK Jr. has long been one of the most prominent anti-vaccine activists in the country. He's been at the forefront of a dangerous movement that has significantly eroded trust in safe and effective vaccines. While RFK Jr. is entitled to his own personal opinions, mind you, not facts, he isn't entitled to use his opinions as the basis for breaking the law and endangering our children. The fact is, among children born in the U.S. between 1994 and 2023, researchers have estimated that routine childhood vaccinations prevented approximately 508 million cases of illness, 32 million hospitalizations, and over 1.1 million deaths. All told, these vaccines have generated an estimated $2.7 trillion in societal savings. That means without these vaccines, not only will our children and vulnerable individuals get sick, but our healthcare systems will have to shoulder the burden of increased preventable illnesses, preventable hospital visits, and avoidable costs. The fact is, vaccines save lives and save our states money. To get rid of them is illogical and unconscionable. To get rid of them in this way is illegal, which is why we're taking Trump and RFK Jr. to court. Before I turn it back to AG Mayes, I want to give the Healthcare Rights and Access team at the California DOJ a shout out for the incredible work they've done to make today's lawsuit possible. While they don't do this work for the limelight, I want to take a moment to shine some on them because they deserve it. Katie Milton, Marnie Ganadis, Kathleen Borgers, Nimrod Elias, Nellie Palma, and with that, I'll turn it back to you, AG Mayes.
Thank you, General Bonta. So I also would be remiss if I didn't thank our team in our Solicitor General's office. We had a fantastic team working on this. And I also want to thank our state agencies, the Arizona Department of Health Services and our Medicaid program Access for providing much of the data that we needed to file this lawsuit. So with that, AG Bonta and I would be happy to take any questions that you have.
If you'd like to ask a question, you may do so by clicking on the raise hand icon at the bottom of the screen. You may also submit questions using the Q&A feature. Please make sure you state your publication after we call on you. First question comes from Rachel. You are now unmuted. Can we unmute Rachel, please? There we go.
Great. Thanks. Can you guys hear me now?
You bet.
Yes.
Great. Thank you so much. Rachel Bluth from Politico. Attorney General Bonta, I think the question is one of standing. Here in California, we have already frozen our vaccine recommendations to what ACIP had recommended at some point last year before some of these changes started to take place. So state law already has those recommendations in place. Why is this lawsuit necessary if California is already following the old ACIP recommendations?
Yeah, no, thank you. And it's a good point. ACIP's vaccine recommendations traditionally have been necessary and integral to national health policy. They've traditionally guided U.S. health insurance coverage decisions, state school vaccine requirements, and how physicians counsel parents and patients. And I have to reemphasize that Secretary Kennedy promised Congress during his confirmation process that he would leave ACIP undisturbed. And then in June 2025, he broke that promise by abruptly firing all 17 ACIP voting members and then unlawfully repopulating ACIP with a majority of his own anti-vaccine acolytes. And as you mentioned, several states and medical organizations, including the American Academy of Pediatrics, have released their own vaccine guidelines as alternatives to those from the CDC. And that's important. That's appropriate to follow science, to follow evidence, to follow public health best practices. But our lawsuit is still important because the challenged actions, the actions that we set forth in our complaint that RFK Jr. has taken and ACIP has taken, they harm public health and they strain state resources by sowing doubt and confusion in vaccines and in science. And that means, in terms of standing, which is based on injury, economic injury, generally, when it comes to the lawsuits we've brought against the Trump administration, California will be forced to expend resources to treat once rare diseases, to respond to outbreaks, and to combat misinformation. So what the actions of ACIP and RFK Jr. have done in terms of undermining confidence and faith in science, changing behavior for the worse, to be anti-public health, that visits harm on California in the form of additional public health costs and need to combat the misinformation. So that's how we have standing here. But your point is important, but it doesn't change the fact that we have standing and that this lawsuit is critical.
Yeah, and I would just add to that, that the fact of the matter is, all of our states, those of us who have reacted to this decision to demote the 7 vaccines and the decision to basically eliminate the recommendation for Hep B at birth, are having to, as General Bonta said, having to expend resources to provide guidance, to set up new infrastructure to deal with this. But I also want to point out that, diseases cross state lines, right? I mean, and obviously the Democratic states are doing everything we can to fill in this gap whenever we can. It's not going to be perfect, but we are surrounded by states with Republican AGs who are not challenging this and are not doing the same things that the Democratic states are. And we know that, rotavirus, Hep B, Hep A, meningococcal disease do not just stay in one state. And so the only body that is designed and capable of advising the entire country and providing scientific guidance to the entire country is the CDC and ACIP. And we now basically don't have that across a number of these diseases and vaccines. And then the other, so we're not protected. And we're going to continue to see these outbreaks across the country, including in our states, even though we're doing everything we can to protect ourselves. And then, and so the other thing I would say is that, this is going to be a problem going forward. This is a ACIP that has been decimated and replaced with vaccine skeptics, which is, it violates FACA, what they have done to ACIP. And we have a duty as state attorneys general to address that in the courts and to ask the courts to help us. And so that's why we, Rob and I, along with, I think it's a total of 15 states, including the governor of Pennsylvania, have filed this lawsuit, and we're seeking declaratory action and injunctions against HHS and the CDC.
Courthouse News wants to know what court district the complaint will be filed in.
It will be filed in the Northern District of California imminently, if not now.
Yep. Any moment, if not.
Any moment.
Next question comes from Apoorva. You are now unmuted.
Thanks for taking my question. This is Apoorva Mandavili from the New York Times. Can you tell me what your goal is for the ACIP part of the lawsuit? Are you hoping to have the current members be taken away and have the old ACIP restored? Do you want to just stop the current members from meeting? What exactly is the lawsuit asking for?
So what I would say to that is, and if you go to page 76 of the filing when you get it, what we're asking for is that the court declare that the Kennedy schedule, is arbitrary and capricious and contrary to law. We would like the court to declare that the secretary's appointment of Kennedy appointees was contrary to law and arbitrary and capricious. We would like the court to declare that ACIP's Hep B decisions were arbitrary and capricious, and we'd like the court to enjoin, vacate, and set aside the appointment of the Kennedy appointees and the Kennedy schedule and any implementation of these actions. So yes, that is what we are seeking.
And would you also ask for the previous members to be reinstated?
What I think we will, I don't think we've gotten to that point yet, but what we are asking for is qualified members to be appointed to ACIP as required under law, and members who will come to this with a scientific background, that will come to it with an unbiased viewpoint, and that will not be working at the direction of the CDC. And I think that's an important part of FACA, which says that the ACIP is not to be controlled by special interests or by the appointing body.
Right.
Okay, thank you.
Yeah, I'll just reemphasize what AG Mays was saying here, that there are rules under the Federal Advisory Committee Act for ACIP, for the requirements and the skills and abilities of those who are appointed, their qualifications, there's rules around the overall constitution of ACIP. It needs to be fairly balanced. And there are prohibitions against inappropriate influence of the appointing authority or by any special interest. And we believe that those rules set forth by the Federal Advisory Committee Act, FACA, have been violated, and therefore an unlawfully constituted ACIP was put in place, was installed unlawfully, and then made decisions which necessarily were unlawful because the body was unlawful. And so we want a reversal of those appointments. We want them struck down as null and void, and their actions that were taken as an unlawfully constituted body struck down as well. Now, there's a number of different constitutions of ACIP that could be lawful. Could go back to the prior constitution that Secretary Kennedy promised he wouldn't disturb, or it could be another set of lawfully appointed individuals that have the qualifications, that together are fairly balanced, and their appointments are not inappropriately influenced by an appointing authority or by special interests. So, but it is clear that the current constitution of ACIP is unlawful, and their actions therefore are as well.
Got it. Thanks.
Next question is from Jessica. You are now unmuted.
Hi, thank you so much. This is Jessica Nix at Bloomberg News. There's a similar lawsuit that we're seeing play out in Massachusetts right now that's a little bit further along, filed by some medical groups, including the American Academy of Pediatrics. It seems very similar to the suit that you're planning to file. So why did you decide to file separately and not join that lawsuit? And how should we think about the differences between these two?
Well, I certainly would let General Bonta take that as well. Look, I think that they are similar, but as state AGs, we represent slightly different interests, and we represent the interests of our public health system. So you'll see in the lawsuit that we talk a lot about the fact that ACIP is deeply intertwined with many of our state statutes, and that ripping its recommendations out will impact our states, and we are going to have to scramble, and already are scrambling to address that. We talk about the public health implications for our states specifically. We talk about the additional mortality and sickness that will occur in our states as a result of this. So I think there were good reasons for us to do this as states as well. And it's not the first time that you've seen multiple groups file different lawsuits. I mean, the tariffs lawsuit is a good example. The state AGs filed that lawsuit, but also a business organization representing small businesses, I think, filed a lawsuit. And then ultimately they were consolidated once the cases reached the appellate court level.
Yeah, that's right. I agree with all that. And when the federal government acts unlawfully, all those who are harmed and have standing to sue may sue. And we're seeing this very often, that state AGs are suing based on certain unlawful conduct by the federal government, and private parties are also suing when they're hurt, and they have independent standing, not uncommon at all, and very appropriate. So the American Academy of Pediatrics, they are leading a lawsuit challenging the same actions in a different court, the District of Massachusetts. Again, ours is in the District of Northern District of California. And that case, by the way, the American Academy of Pediatrics case has survived a government motion, a federal government motion to dismiss based on standing and failure to state a claim. So they are moving forward. But we have unique harms, as AG Mayes just mentioned. And so it's important that all of the harms against all of the entities that are suffering from an unlawful action by the federal government be brought to court and be considered. And those harms to public health from decreased vaccine uptake and thus increased disease incidence, and the financial harms from poor public health. It'll be increased Medicaid spending and additional expenses to combat misinformation and revise public health guidance. Those harms are unique to us, unique to states, unique to this multi-state coalition. So very critical that that set of unique harms be put before the court. And we are very grateful that the American Academy of Pediatrics has brought a suit as well. There is strength in numbers, and they were harmed as well. They should bring a suit, and we'll bring ours and present our unique harms to our respective courts.
Thank you.
Next question comes from Liza. You are now unmuted.
Hi, this is Liza Gross from Inside Climate News. Thanks so much for doing this. Several studies have shown that climate change may accelerate the spread of vaccine-preventable diseases. And coming on the heels of this lawsuit is coming on the heels of the EPA revoking the endangerment finding. And I understand that AG Bonta is preparing to file suit against the administration on that. And I wonder, one, if you both could speak to the interacting harms that are happening here, and also AG Bonta, when you plan to file that suit.
Sure. With respect to the endangerment finding, as I think I mentioned in the past, we are very concerned, very disturbed. We've by the actions taken by the federal administration, we've made our position known multiple times in terms of comments and statements we've issued, and we will continue to push back against what is a very similar action as to the action we're challenging today in this lawsuit, in the sense that it's completely divorced from and untethered from science and facts and data and evidence. We must follow the facts, the science, the evidence, and data. And you've just shared some, including the interconnectivity between climate change and the spread of preventable diseases, vaccine preventable diseases. And I think that just puts a stronger point on what we're doing today. The key point here, or a key point here, is that these illnesses that we're talking about, they're preventable. The hospital visits that will result because of this new child vaccine schedule, they're preventable. The costs that will be incurred by the states, as we share in our complaint, they're avoidable. And if you follow the science, if you don't go into conspiracy theories and just follow where the data and the evidence, the science and the studies take you. So we have nothing to announce today on an additional lawsuit with respect to the endangerment finding, but our position has not changed with respect to our firm disagreement with it, the harms that it will cause, and the injury that it will visit on California, and our intention to take action.
Yeah, and I appreciate the connection between the two, and I think there is definitely one, and I'll give you an example of that. So obviously here in Arizona, and probably to some degree in California as well, we are dealing with an increase in the amount of extreme heat events in Arizona as a result of climate change. Those extreme heat events end up impacting people who are unhealthy more than others, and lead to increased deaths. A lack of vaccines, a lack of access to vaccines starting at birth will make our population sicker. and more vulnerable to extreme heat and to climate-related disasters. And and that will be sort of a self-perpetuating cycle where you have a less healthy population that is less capable of withstanding the impacts of climate change. And then you have climate change that is expanding and growing ever more dangerous, having a greater and greater impact on a less healthy society. So, again, I agree with General Bonta. The endangerment finding was terrible, or the elimination of it, and or attempted elimination of it, and something that is worth fighting against.
Thank you very much.
I believe one more question. The question is, I believe you are suing the new CDC director. Is that just against the office, or was he involved? And if so, what was his role?
Let me check on that for you. It is against RFK Jr. And the seat. Yeah, hang on.
Yeah, I have Acting Centers for Disease Control and Prevention CDC Director Jay
Bhattacharya.
And
Bhattacharya, correct. Who was one of the people, I believe, who wrote the decision memo when he was not the head of the CDC. That's one of the allegations that we make, or facts that we point out, which is that the decision memo itself was not even written by individuals on the ACIP. It was written by Bhattacharya when he was the head of the National Institute of Health, and it was written by the Administration for the Centers of Medicare and Medicaid Services, Mehmet Oz, and Marty Makary, the Commissioner of Food and Drugs. That memo bypassed ACIP entirely, and it then went to the then acting CDC director, Jim O'Neill, urging him to remove the 7 vaccines from the CDC's list of universally recommended childhood vaccines. So it didn't even go through, while the Hep B vaccine technically did go through ACIP, the 7 demoted vaccines didn't even go through ACIP. It went through it went through HHS, and the head is the CDC directly in violation of federal law.
Thank you. That was the last question.
well,
All
thank
right.
you, everyone.